When communication gets hard. Gentle confrontation and therapeutic boundaries in nursing. As communication becomes more complex, nurses must rely on clinical judgment, not avoidance or reassurance. This module focuses on gentle confrontation and therapeutic boundaries, two skills that require professional courage. Gentle confrontation is a therapeutic technique used to help patients explore inconsistencies between thoughts, feelings, and behaviors. It is not punishment, criticism, or argument. It is grounded in empathy and trust. Discrepancies may exist between what a patient says and what they do, who they are and who they want to be, or how they view themselves compared to reality. Identifying discrepancies supports insight and change. Therapeutic confrontation is used only after rapport is established. The nurse focuses on specific behaviors, maintains respect, and supports patient strengths. The goal is understanding, not control. It can be viewed as an unmasking of the patient's feelings and put it together in a way that the patient has not been able to do. Confrontation is an extension of empathy and is dependent upon empathy having taken place. Confrontation is not an attack, negative, or punitive. The goals of gentle confrontation are therapeutic and patient-centered. Confrontation helps patients explore experiences that feel painful, avoided, or internally conflicted. It allows the nurse to identify inconsistencies, discrepancies, and areas of internal conflict. Gentle confrontation also helps patients recognize defense mechanisms they may be using, analyze their own behaviors and feelings, and begin accepting responsibility for them. Finally, it demonstrates the nurse's genuine concern for the patient and commitment to their growth and safety. Discrepancies and distortions occur when reality does not align with personal desires. Patients may contradict themselves or distort experiences in an effort to reduce discomfort. Discrepancies may occur between what a person feels and how they behave, what they say and what they do, or how they view themselves compared to how others view them. They may also occur between who a person is and who they wish to be, between statements made at different times, or between how an individual reacts and how most people would react in a similar situation. Behavioral distortions occur when an individual cannot face reality as it exists. To regain emotional balance, behavior may change in ways that avoid discomfort rather than address it. Therapeutic confrontation must never accuse, attack, or punish. It should only be used after trust and empathy have been firmly established. The nurse confronts specific, concrete behaviors that the patient has the capacity to change and uses the patient's strengths to support the process. Gentle confrontation is most effective when paired with empathy and a calm, matter-of-fact approach. This reduces defensiveness and helps the patient remain emotionally regulated and in control. The nurse intentionally highlights strengths and supports autonomy while forming a therapeutic alliance. This approach is particularly useful with patients experiencing paranoia, as it decreases suspiciousness and promotes trust. Therapeutic boundaries define the professional limits of the nurse-patient relationship. They protect the patient, the nurse, and the integrity of care. Professional boundaries are essential to safe and ethical nursing care, especially in psychiatric settings. Many psychiatric units are no-touch environments. Patients may need gentle reminders about physical boundaries to protect both their safety and the safety of staff. Patients may also misinterpret empathy, focused attention, or consistent presence as personal interest. As a result, they may ask for friendship, request phone numbers, or make flirtatious or overly familiar comments. These behaviors are not uncommon. They should not be ignored, and they should not be shamed. The nurse's role is to respond calmly, clearly, and matter-of-factly, and to redirect the interaction back to professionalism and respect. Maintaining boundaries is not cold or rejecting. It is therapeutic. Clear boundaries provide structure, reduce confusion, and protect the nurse-patient relationship. When boundaries blur, patient safety is compromised. Professional boundaries maintain trust, objectivity, and ethical nursing practice. On NCLEX, the correct answer reflects professional boundaries and clinical judgment, not emotional closeness. Nurses support patients without rescuing, fixing, or over-involving themselves. Gentle confrontation and boundaries are not cold or harsh. They are expressions of professional care. This is how nurses communicate with intention and think like nurses.